Start your mornings right with the Medicare Morning Show. Join our dynamic trio of hosts, John Davis, William Lacey, and Felicia Evans, as they bring you the latest insights, expert advice, and real-life stories to help you navigate the world of Medicare.
And we are back, the Medicare Morning Show, just like every Monday morning at 10 a.m. We bring you news that you can use regarding health, community, and Medicare education. My name is John Davis, and I'm your host today, along with Mr. William Lacey and Felicia Evans. Y'all, welcome to the show.
Hey, y'all. What's going on?
Here. Early in the morning.
It's a great Monday morning. We have a great week starting off, so I'm glad to be here to see all y'all. Well, to see y'all, William and Fee. Felicia, I see you have on your camouflage today, like you going to battle. Who you fighting?
We're gonna have the battle of the plans. Original Medicare versus the Medicare Advantage. So I'm here to go to war on getting this information out to the people.
Okay, well, we're gonna go ahead and get started. So, y'all, today we are talking about the battle between Original Medicare, which is Medicare Part A and B, battling Medicare Advantage plans, which you all know from our previous episodes. We talked about the differences between Original Medicare and Medicare Advantage plans. So we're going to talk about that because it all depends on what you need and what benefits you and how you use your health insurance to decide what is the best option. So that's what we're going to talk about today, y'all. We got a packed show.
Yeah.
Okay. I'm excited. Let's get into it. Let's go.
Yeah, well, here's the thing. To those of you who have just began listening to our show, I want to say, first off, welcome. Secondly, please like, comment, subscribe, and go back and look at some of our past episodes because we talk about the differences between Medicare Part A, B, C, and D. It's what I call the series, the basics of Medicare series. So go there, check it out. Just like William is on YouTube, Facebook.
Yes, I like to watch the YouTube version of it. That way I can actually see it. You're actually able to give it a thumbs up. You can even do the comments like you said. You can subscribe. So all of those things are good. I listen to it on Spotify as well. So
absolutely.
We everywhere.
So yeah, y'all, we got a packed show for you. So we're gonna go ahead and get started. But we're gonna first talk about the battle between Original Medicare and Medicare Advantage plans. Then, of course, you know, like we do every week, we're gonna usher you out into the week with fun things to do in our Beyond Bingo segment. Every time I say Beyond Bingo, people start laughing. But hey, I'm tired of playing bingo. That's why the session is there. The session is there because I'm tired of playing bingo. But before we get into any of that, Fee, I heard you got something special for the people today. So let's go ahead and get started with that. What you got for us?
All right. We got the healthy tip of the day. Let's go, y'all. Hey, guys. Hey. So the healthy tip of the day is get moving. Doing aerobic exercise or cardio is one of the best things you can do for your mental and your physical health. Getting to a park, getting to your favorite gym that's covered with your insurance, just getting outside. You can reduce your harmful type of fats that builds up in our body over time from just sitting and being a couch potato and watching TV. Get outside because according to the physical activity guidelines for Americans, we should strive for at least 150 minutes of moderate intense activity every week. That sounds like a lot, but if you get your Fitbit or you get your watch and you count your steps and it'll count your heartbeats and all things like that and all your moderate activities in minutes, you'll go through the 150 minutes in no time. So again, guys, get moving.
Nice.
Felicia, why do you always come up with these little pop-ups? We got the breaking news segment, and now you're doing a healthy tip of the week segment. I'm just happy to be here. I'm just happy that you're on this show.
It's so early, so I'm trying to get the blood pumping and everybody's, get them moving, get them knowing, get them knowing what's going on out here. And why not with the Medicare Morning Show?
Absolutely. It's the right thing to do.
Yeah.
And the good thing is, like Felicia said, guys, a lot of you all have the a gym membership, a part of your Medicare Advantage plans. So if you have a Medicare Advantage plan, you may want to check those benefits to see if you have a free gym membership or $0 cost membership at a lot of the local gyms around the area. So
and get that free Fitbit. Some of those Advantage plans give you that free Fitbit. And that.
All right, y'all, let's talk about the differences. Pull up that chart. What we got?
All right, let's get it. All right, so we have categories on the left-hand side, which is amazing. And it lets us know that we're going to compare the OG of the OGs, the original Medicare, with the Medicare Advantage plan, which is also Part C. So that first part, comparing under original Medicare, covers hospital in Part A and medical Part B expenses. But the Advantage plan covers A and B, often includes extra benefits like dental, vision, and hearing. That's the things that we need. We need those extra pieces of the puzzle, and the Medicare Advantage plan does that when it comes to coverage. I'll go over one more when it comes to provider flexibility. Under the original Medicare, any provider that accepts Medicare across the U.S., all right? But then under the Advantage plan, it's limited to network and providers depending on the plan. So yeah, John, like, that's kind of hard. Do you think that's kind of hard to kind of make a decision between A and B at this point, like Medicare Original and Medicare Advantage?
Well, let's talk about that because, William, the first category, first off, let's just say Medicare Advantage plans are also known as Medicare Part C plans.
Yes.
So remember, you got to have Medicare Part A and B to even enroll into a Medicare Advantage plan. So that's just the basics. But William, we look at this category number one, the coverage. It says original Medicare covers hospital Part A and medical Part B expenses. And then the Medicare Advantage plan also covers Part A and Part B, often includes extra benefits like dental, vision, and hearing coverage. What do you have to say about that, Lacey?
That is huge. We did cover, of course, I'm going to refer to last week. Check out the podcast where we covered Part C, or Medicare Advantage plans. And as you get older, you tend to need more healthcare. You tend to need more dental, more vision, more hearing, not less. And so it is a true advantage on the Medicare Advantage side to provide those, whereas original Medicare does not. Something a lot of people want and need.
Absolutely. So Medicare Part A, of course, covers your hospitalization. And what that means is that it covers for you to stay into the hospital or stay in the hospital overnight, right? It's kind of like a hotel stay. And then we have Medicare Part B, which is medical expenses. I call them doctors and procedures. But when it comes to your dental, your vision, your hearing, your rides to the doctor, your gym membership, we just talked about that, is usually not covered under original Medicare, just having Medicare Part A and B, okay? So that's one point. So I'm going to say points. I'm writing points. I'm a point for a Medicare Advantage plan. Why? Because it includes additional benefits.
Yeah.
Like dental, vision, hearing, rides to the doctor, hearing coverage, all of that other stuff. But let's go down to provider flexibility, William, because it says here, original Medicare, you can go to any provider that accepts Medicare across the U.S.
Yeah. So I can travel and be in Ohio. I can travel and be somewhere as long as, they accept Medicare.
There you go. But with a Medicare Advantage plan, it says that it's limited to a network of providers depending on the plan. What do y'all think about that? Let's talk about that.
So that limitation can include acronyms like PPO, HMO, POS, a whole bunch of different ones. And that can be confusing. That can be challenging.
Yeah.
The original Medicare, if you're making points, this is a huge one.
Yeah.
Especially, again, like we talked about last week, in those rural areas where specialists are not very common. And so you can go to any doctor. 93, I like the stats, 93% of doctors in the United States accept original Medicare. That's huge. So you've got you can be very limited on the Medicare Advantage side. It still can work, even for those in the rural areas, as long as you make sure all your doctors are in network.
Yeah. And some of my rural clients, they have to travel. They have to come to the major cities. It may be a 30, 45-minute drive, but to see their favorite doctor, it's nothing like it. It's like, okay, I couldn't find anybody where I live, but a 30-minute drive to make sure I'm taken care of, why not?
It's worth the drive. Yeah. So when I think about provider flexibility, it's everybody's hope and dream and wish. We see it every day to be able to go to any doctor they want to go to anywhere in the world without having to think about, like you said, William, those acronyms like your HMOs, your PPOs, and the different provider networks. So I'm going to probably say that original Medicare probably wins this battle. Not this battle, not the entire. What are
this category? This category.
This round, John.
This round. So we're going to say that original Medicare wins the round for provider flexibility. Do we agree?
We agree.
Okay, so we're tied 1-1.
1-1. Let's cover the next two, and let's cover the next two. So under cost, people want to know about them. Give me my money, right?
Money.
So. 20% co-insurance after deductible. This is under the OG original Medicare, and no out-of-pocket limits. You're looking at the Advantage side. The Medicare Advantage side is typically lower premiums, may have co-pays, and has an out-of-pocket maximum. So it's that may have co-pays. That's like may.
Let's talk about that. William, do you got a stat on that?
Well, well, actually, I do, but I won't go to the stats.
Look, I want stats.
I need stats
now.
I need numbers.
You know what? Okay, if I could just briefly back up. When we look at two categories, original Medicare versus Medicare Advantage, they're just about even when it comes to the population. About 35 million, right at 34 million people that qualify for Medicare have only original Medicare, whereas about 32 million have Medicare Advantage. So it's pretty even. This is a very even battle. And that's why we're going through this exercise. But let me just go back to this, this category. The scary thing about Medicare Advantage, the Medicare, original Medicare, the fact that there's no out-of-pocket limit. If you don't understand what that means, it can sound pretty good. Like, hey, I have no limits. Well, no, it's a cost limit. It means if your bill is $100,000, you could be paying $20,000. If you go back in later on that year and you've got rehab and more surgery and it's $500,000, then you owe $100,000, and it just keeps going. Whereas Medicare Advantage annually has a limit. I'll just tell you this stat: right around $4,500 is the average cost out of pocket maximum cost for at Medicare Advantage plans nationwide.
Yeah.
Okay, so I want to talk about that because what exactly does this 20% mean? So when I think about 20%, most people that we talk to are retiring and they have a plan with their job.
Yeah.
And they're used to paying their $10 copays when they go to the primary care doctor. They're $50 when they go to a specialist. The difference between the type of plan that you were on back then when you were working and original Medicare is that original Medicare charges a co-insurance amount, not a copay amount. What that means is a co-insurance is always a percentage of your total bill. So, when you go into the doctor's office, I'm going to shout out my doctor, Dr. Harvey Bowles. He has a sign on the screen that says, he has a screen there, and the sign says copay due upon services rendered, right? The day they're rendered. And see, a lot of people think, oh, he's just being, that he can help us out. But the reality is that a lot of those contracts that doctors sign says that they have to collect this copay up front before services are rendered, right? So when you have a co-insurance, though, you usually don't pay anything up front. You usually get billed your 20%. And just like William was saying, 20% is not bad if you got $100 bill, right? You pay the $20.
Yeah.
But what if it's a cancer situation or a surgery situation where it's now $100,000 bill, which is not far off?
No, it's very common, actually.
It's very common. And your percentage that you pay is 20%. So that's going to be $20,000. That's a lot of money, Fee. And I know you all about your money, as you say it.
Yes.
Okay? So the downside, though, of the 20% is that there is no cap. Remember, we talked about this on last week's episode. Go check it out. We talked about the MOOT, which is max out-of-pocket max. On original Medicare, there is no MOOT. There is no max out-of-pocket cost. You pay the 20% no matter what the bill is, and that's that.
No matter what time of the year, and no matter how many times you went to the doctor.
Right. But
this category.
Well, let's see, because let's talk about Medicare Advantage, because it says typically lower premiums may have copays, has an out-of-pocket max. So the copays with a lot of Medicare Advantage plans, William, are pretty low for certain services, right?
Yeah.
They are. Well, I'll tell you this: the majority of Medicare Advantage plans have copays, so very few tend to not have any. But they are low. You mentioned a very common one: $10 for your regular doctor, and maybe $50 for a specialist. On a Medicare Advantage, you can usually go a little bit lower than that. Sometimes it can be 15, 20, 30. Typically, they run pretty low.
Yeah.
Okay. Right. So, but when we think about a Medicare Advantage plan, it does have a max out-of-pocket cost. So me paying my $20 copay for specialists or my $50 copay for specialists, even up to my $500 in a surgery for a surgery, never really adds up to. Well, I've never seen many people reach the max out of pocket on a Medicare Advantage plan.
2% of people that have Medicare Advantage reach their maximum out of pocket in a year. 2%.
Yeah, low.
2%. So that's not many. So what that really says is that with the Medicare Advantage plan, you're probably not going to pay a whole lot of money out of pocket every year, but there's a possibility that you could.
Right.
It all depends on your situation.
Everybody's different.
Everybody's different. So I don't know who wins this battle, but I'm going to say that I prefer to have typically lower premiums. I'll pay my copays.
That's me personally. Yeah.
Yeah.
And
I'm going to have a max out of
maximum. Yes.
Yeah.
Okay. So are we going to give that battle to Medicare Advantage?
Yeah, we get that point to Medicare Advantage.
I would give it to Medicare Advantage. When you look at the Medicare and You, the 2025 is out. That's on Medicare.gov.
Yes.
It does mention on the original Medicare side, Medicare supplements. We'll probably have a show on that down the road.
Absolutely.
But that's where you can limit your out-of-pocket maximum if you purchase that in addition. Right. As this stands right now, you got to give it to Medicare Advantage.
Yeah.
Okay. So Medicare Advantage won that round, but now we're on to round 4.
1, 2, 3, 4.
Plans. Let's go to 4. Round 4. I'm
so we're gonna talk about
I'm getting tired, Fee.
Yeah.
We ain't getting tired. We ain't getting tired. We almost there. So look, prescription drugs. A lot of people have that concern when it comes to that. And with the original Medicare, it requires separate Part D plan and drug coverage, which means you gotta go searching for a prescription drug plan. And then on the original and the other Medicare Advantage plan, it often includes Part D drug coverage bundled with the plan you choose. And that's why when I think we talked about on one show is if you have that agent, if you have them make sure that your doctors are covered, your and your prescriptions are covered, because that's a thing. It has to be covered under the plan that you wish to have all the extra bells and whistles, the vision, dental, hearing, and gym. But you got to make sure that the most important thing is covered, like your drug coverage, your prescription drugs.
Yeah, William, what's your thoughts on that? What's your thoughts on the prescription drug comparison between OG, original Medicare, and Medicare Advantage?
So first of all, you're required, otherwise you get penalized, purchase a separate prescription drug card, even if you don't take a prescription.
Still get it.
You got to get that. Costs have gone up quite a bit the last few years. So you got to get your own. As it stands right now, check out our other podcast with Sherry Bagwell, which shows the changes that are coming. But as it stands right now, if you get your own prescription drug card, many of them have deductibles that you got to pay for first. You got to meet those first. Then you get the privilege of paying copays. And then, of course, you have the infamous donut hole or the catastrophic phase. You got all those different elements. Whereas with Medicare Advantage, you get the drug card is generally included. It doesn't cost you anything. It usually doesn't have that deductible attached to it either.
Right.
There are co-pays. So there's that for now.
Yeah.
Well, you know, and here's the thing about the prescription drug plans. You have to search for a prescription. You have to look up your medications, no matter whether you do a Medicare Advantage plan or whether you do a Medicare Part D prescriptions plan that's a standalone, right? So you're going to have a formulary on each option. You're going to have a list of covered drugs. That's what a formulary is. We talked about that with, like William said, with Sherry Bagwell on one of our last shows. You're going to have step therapy, prior authorizations required for certain medications. That's just
quantity limits.
Yeah, that's just the standard.
Yeah.
So this is a tough battle, though, y'all. I want to hear, William. What do you think? Who do you think won who won the battle for yourself for the prescriptions?
I still would lean toward Medicare Advantage on this because it is bundled. You don't have to go searching. That's one, and you can also probably not pay a deductible, probably not pay a monthly premium. So I would still lean toward Medicare Advantage on this round.
Okay. Fee, what do you think?
I like to go against the grain. You know, money's not a thing for me if I'm retired. You know, I'm going to go ahead and see that in my future. So I'm going to probably say OG because, you know, it requires it. I can pay it. You know, that's my situation. So,
okay.
So it's like but you got to break the tie, John.
I'm going to break the tie, and I'm going to go with, this is a tough one because, but see, here's the thing about the battle. You can't include all the other benefits.
I'm just looking at the prescriptions.
Prescriptions. I'm going to go with Medicare Advantage plan on the prescription drugs.
Okay, that's fair.
Why?
Okay.
Why? Because, and we don't know the plans. Well, we can't discuss the plans for next year. But what I'm going to say is a lot of the Medicare Advantage plans that I've seen that have prescription drugs included, the deductibles are usually a little bit lower than just a standalone prescription drug plan, and it's $0 many times with the Medicare Advantage plan. The standalone prescription plan, you got to pay for them separately. So, I broke that down. So Medicare Advantage,
a win is a win. A win is a win.
Let's go right here. What we got for extra benefits?
Okay, well, original Medicare, there's no vision, dental, hearing, or wellness programs. Ouch. However, on the Medicare Advantage plan, often includes those extra benefits. So it's kind of like, do you want to get your eyes checked? Do you need those new glasses? Do you want to get your cleanings every 6 months? Get your hearing tested because your grandkids keep calling, Papa, and you ain't replying. You know,
maybe you're okay with that.
You don't want to get a grandkids.
Maybe you don't want to hear them or see them or talk to them. But I can't say that because I have the best parents that are really great grandparents. So I'm assuming that it's across the board that all grandparents love their grandchildren and want to be around them all the time. That's true. Like my dad, he wants to be around the kids all the time.
See, so yeah, I mean, so it's like that between the two. Now, for me, I go to my regular dentist appointments. I go get my eyes checked. Like I said, I have fitness. I like to go to the gym, even though I got all these packages. I got to figure out which one I'm gonna go to. You know, I'm going to say Medicare Advantage that is like a huge thing because, like you said, you get older, you need more. And that kind of reminds me of an employee benefit thing that I used to have with an employee. If I get older, I want to keep that same momentum with my vision, dental, and hearing. So at least that piece.
Well, let's dive a little deeper into that because you can still get dental, vision, and hearing.
Yes.
As a standalone plan, Felicia. You don't have to get it through your Medicare Advantage plan. Now, I understand you like simplicity.
I can keep it simple.
You
Keep
told
it
me that earlier.
simple.
True.
You like simplicity. So if you don't want to go out and get a standalone dental, vision, and hearing plan, it would require for you to have a Medicare Advantage plan.
Right. But the OG original Medicare does, and having that card is not going to give that to me. So now I got to go search and have a separate card. It's just a lot. I just need one card
Okay.
and I want to be able to keep my red, white, and blue card, to the side and just pull out that whatever plan I got. Bam, bam, bam. That's it.
Okay. So did you already vote, Fee?
I did. I said a Medicare Advantage because I need to be simple. Keep it simple.
Okay. So I'm gonna go with you, Fee. I'm gonna go with a Medicare Advantage. I shouldn't have said it, William. I should have let you go first. William.
No, it's fine. I'll be the original Medicare advocate in this one. No, that's not where I'm necessarily voting.
Oh, okay.
John did bring up a valid point. You can purchase a separate vision, dental, and hearing plan.
Okay.
They're somewhat affordable. A lot of times they're grouped in together. And there's also one more thing. There are some, if you were to have original Medicare and you were to get that supplement, some of those do offer gym memberships included.
Okay.
So there's that. Now, which one would I pick? I'd still go with Medicare. And
Okay.
Why? Of course, we're not going to get specific, but anytime you get a dental through a separate one, there's always going to be percentages. That's generally how they work. They'll cover 50%. They'll cover 80%. They'll do. Whereas generally on the Medicare Advantage side, many times these dental and vision plans are first dollar, meaning if they give you $500, you get the first $500. And if it costs more than that, then it's up to you. You may get $1,000, $2,000 for dental.
Mm-hmm.
It costs more than that. So if you can keep your costs within that first bit of money, you may not have to pay anything. So I think the advantage is to the advantage.
Well,
okay.
All righty.
So Medicare Advantage won that round, and now we have enrollment. Now this right here is an interesting one. William, start off talking to us about the enrollment.
So I'll just go with the original Medicare. Generally, people get a notice that they're going to be signed up, at least for Part A. Part B, some people, especially if they're not receiving Social Security yet, they'll have to go ahead and enroll. But either way, it's a pretty dramatic thing. People normally, they don't miss that. They sign up for it. They're very aware of it. And then you don't have to worry about it. It's over. It's pretty much over. If you miss it, then there is a provision to get Part B. But for the most part, it's nearly automatic. So original Medicare is easy on this one.
Okay. So when we look at Medicare Advantage plans, it says you can switch during AEP or with special circumstances, which is those SEPs. And we have another show coming up, not next week, but the show after that. We're going to talk about all the enrollment periods, because we are coming up onto Medicare annual enrollment period for people to enroll. So the Medicare Advantage side is going to be on fire in a month, mainly because a lot of people that have those Medicare Advantage plans has to decide whether they want to stay with that plan or whether they want to transition somewhere else. So it's their enrollment opportunity. So that's pretty basic when it comes to enrollment. So I'm going to say it's easier. No, I'm going to pause. Fee, what do you think?
Good host, John.
Yeah, you like that? Fee, what do you think?
I'm going to go with the advantage, the Medicare Advantage on this one, because I want to be able, because something may change and I may want to, do something different, with my plan, or go with a different, provider. So I'm going to go with Medicare Advantage on the enrollment piece, giving my point to that.
All right. So where we at? William, where were you? You were an original Medicare.
On this one. This is easy.
Felicia saying Medicare Advantage. I'm going to go with Lacey, and I'm going to go with original Medicare. Okay. So we went through how many categories? 1, 2, 3. 6 categories, but we need a tiebreaker. Well, actually, we don't need a tiebreaker, but I want a tiebreaker. So let me ask.
Tiebreaker, definitely. And remember, if you win a round doesn't mean you win the whole fight.
It's real.
True. That's true. So So what I see from what I'm looking at, coverage options says it's better with. We voted that it's better probably with the Medicare Advantage plan, right? That was
Right.
the first category. Provider flexibility. Everybody wants flexibility. Everybody wants to go to their doctor of their choice, no matter where it is in the United States. So original Medicare won that round. Now we're looking at the cost. Remember, original Medicare has 20% across the board with no max out-of-pocket costs. Medicare Advantage plan has that max out-of-pocket, and it's usually average around, William, you said about $4,500 average.
Yep.
Right.
Max
Yeah, that's what
out-of-pocket.
he said.
So I can say Medicare Advantage won that round. And then we have prescription drug plans. That was pretty much a situation where we had to kind of just pick on our own. It wasn't really like a huge determining factor.
It's very, Ugh.
So, but we
I'm
went
gonna
with
say
Medicare Advantage still won that round.
Medicare Advantage still won that round. Yeah. What about a prescription? We already covered that. Okay.
we covered
then we
prescriptions already. Yeah.
By a landfall, Medicare Advantage won that because all the extra benefits and nothing extra comes with original Medicare. And then
Right.
enrollment is kind of personal preference too.
Yeah.
You know, what works for you, what doesn't. But there's some things on this chart that's not here for you that you talked about earlier today. And I know one of them was travel outside of the United States.
Yeah, that one. And then the is the prior authorization on here? No, I don't think that was on there either. So that's another one where you don't need prior authorization when it comes to original Medicare, but of Medicare Advantage, it's a lot of times with major things you may have to have that prior authorization before you make those moves on those procedures you may need. So
that's a big one. So
that is huge.
So to explain that a little better, so a prior authorization is something that healthcare companies, insurers may request from a provider to pretty much confirm medical necessity, or to kind of see what have you done to handle the situation before it got to the point that it's at, right? So with original Medicare, those stipulations are not really monitored as much. It's not an HMO. It's not a PPO plan. It's just original Medicare, and you pay the 20% if you want to have the service done. Now, of course, it still has to be medically necessary, so no cosmetic surgeries and stuff like that, but just regular procedures. It would be easier for your provider many times if you had original Medicare instead of Medicare Advantage plan. So, William,
John, I will say this: even if Medicare Advantage seemed to win many more rounds, the fact that second category, for instance, if none of your doctors are in any of the plans available in your area, you must go to original Medicare. You may have a different way to supplement that original Medicare, but that is almost like a little bit of a knockdown in a round. That's a strong one there. So it could affect the score for the entire.
And I think prior authorization does too. Some people just, if you have multiple health conditions, you have multiple surgeries scheduled or surgery scheduled, it's probably not a good idea to change your insurance from original Medicare into a Medicare Advantage plan once it's already been approved and stuff like that. So that's a knockdown one too for me.
I agree.
Yeah. What about traveling outside of the United States? Because we said, Fee, here's the thing, Fee and Lacey. We said that with original Medicare, you can go to any provider that accepts Medicare across the United States. But what happens if I go to Jamaica?
No.
So,
never happened.
So Medicare, the 2025 Medicare and You simply states that original Medicare doesn't cover medical coverage outside of the United States. Period. That's just.
Period. It's just you won't work.
I'm glad you said Jamaica and not like Kazakhstan, because do people go on cruises?
Most definitely.
Yeah. So this is a realistic thing. Medicare Part C generally doesn't cover that, but I've assisted people with Medicare Advantage that have been on these cruise ships and had a medical occurrence, and many times these Medicare Advantage plans will cover as long as the person pays for it, they submit it, it gets approved by the Medicare Advantage, and then they get reimbursed. Okay. So they still have that little bit of a benefit. A med sup, if you attach it to an original Medicare, could possibly give you coverage outside of the United States. But original Medicare absolutely, positively does not cover.
No.
Okay. So is that a battle?
That's the battle.
That's it.
Yes, it is.
Yeah.
So, Fee, what's your vote on the coverage outside of the United States? Is that a big deal to you or no?
It's not a big deal for me. It's not a big deal for me.
Okay. What about you, Lacey? Coverage outside of the U.S.?
Not a big deal. Not really.
Well, look, I'm sorry. I travel a lot, and it's a big deal to me. But because I'm out, but because I'm outvoted, we're gonna say Medicare Advantage ran that battle. So,
all righty.
So look, y'all, we have a new episode. We have a new segment on the show, and it's actually always been available, but we're finally getting people to take advantage of it, where we actually can answer your questions, and that's what we're about to go to right now. Fee, can we get a couple of those questions pulled up here?
I sure can. Give me 1 second.
Well, now you know. I felt that in my chest.
What happened?
So this is your double whammy question for Miss Brenda out of North Nashville. And she asked, can she get dental, vision, or hearing coverage with original Medicare?
I think we already covered that. Lacey, what you got? Can you get dental, vision, and hearing coverage with original Medicare?
Absolutely not. I mean, there's always slight exceptions if it's connected to medical, but generally the answer is no.
No.
Okay.
Sorry, Miss Brenda.
But Miss Brenda, you can go and get a standalone dental, vision, and hearing plan. If you need that, let us know and we can help you get it. Go to MedicareMorningShow.com. Send us a question.
We'll be able to help you.
Just get with us here.
Nice.
All right.
We got another question coming in from YouTube. Like, comment, and subscribe. From James out of Pulaski, Tennessee, and he's asking, which one is cheaper? Original Medicare or the Medicare Advantage?
You got that down? All right, I'll go. In general, they cost the same.
Okay.
Yeah. Both require you to pay the monthly Part B premium, which the average is about $174.70.
Okay.
Al, John, do you ever get pat down by the police? Don't answer that. I'm about to stat you down. So 89% of the Medicare Advantage plans that include prescription drug coverage, 66% of these plans charge no monthly premium other than the monthly Part B premium. In other words, if you would like a $0 plan, Medicare Advantage plan, you can most likely get one.
All right.
Okay. And what was his name? James?
James out of Pulaski. Okay.
So James from Pulaski. I like Pulaski too. So they have a fish sandwich place down there. Let me tell you something. They got a fish sandwich place down there in Pulaski.
Okay.
I've been there. All right. So James, if you want some good fish, I'm gonna reply back and send you the name of this fish place. But anyway, listen. So when we talk about the cost, so that's a touchy one, William, because what about the copay? What about the co-insurance at 20% on original Medicare compared to the $0 or the lower copays on Medicare Advantage plan?
But even then, so it just depends on it. It depends on the utilization. If you're using it quite a bit, then you got that 20% thing hanging over you with the original Medicare, but then you got copays on the other end. So now you're adding a lot of variables. I guess what I focused on is the premium part of it, because they said which one is cheaper to obtain. So I was focused on a premium, but you're right. When you add those other variables, it really is per person at that point.
Okay, so James, let us know. We can help you out. Look at your
another question, guys. Oh, we got another question.
What else you got?
Y'all ready?
We're ready.
Mm-hmm.
Miss Deborah out of Mount Pleasant. She asked, can I see any doctor with original Medicare or with a Medicare Advantage plan? Oh,
John, you can take this one. Go right ahead. Knock it out.
Unfortunately, no. So with original Medicare, like we talked about earlier, you can go to any doctor who accepts Medicare around the country. On a Medicare Advantage plan, there are a network of doctors. Your doctors could be in network, or they could not be. I encourage you, Ms. Deborah, to check with your licensed Medicare advisor for additional help, or give us a call.
Nice
Boom.
job.
Yeah.
There we go. And I think we're going to, we got time for one more question? Do we got
Let's
time
get
for
one
one? Because
more.
one more just popped up. Well, actually,
Yeah,
three more just
one
popped up. Okay, one more. Here we go. Let's see who this next one is. From, looks like Instagram or Facebook. I can't remember which one that is. Miss Janice. And then Antioch. Come on, Antioch. And she says, she asks, which one is better if I have a chronic condition? Ooh.
So this is a question that's similar to James did. Better, it's up to you. Again, there's many variables. A person has a chronic condition generally takes more medication, goes to see doctors and specialists more often, and it depends on the type of chronic condition. Is it diabetic? Is it dialysis? I mean, there's a lot of things to consider. In the past, schools of thoughts is if you have a lot of high healthcare costs, original Medicare with a Medicare supplement, again, which we'll discuss down the road, generally would have been the way that person would have been advised to take, because that covers that 20%. So it's a really seamless type of coverage. And if you're in pretty good shape, you're good at managing your health, even at an older seasoned age, then you could go with a Medicare Advantage and have all the benefits, all the extra goodies and things. But again, that's the past thought. There's some more present things that maybe we'll tackle down the road to flip that table over. But that's the general way the advice is gone.
All right.
Yeah,
Thank you, everybody, for all the questions.
I got a comment, Fee. I got a comment.
I was excited about the question. What's your comment?
I'm not done, Fee. You just cutting off our session.
I was excited because it's the first show we've had questions and people was actually like flowing in questions. I was excited. So
thank you. Next, John.
And we need more. So listen. So with the Medicare Advantage plans, was that Miss Deborah from Antioch?
That was Janice.
Janice.
Okay, Miss Janice. So listen up, Miss Janice. Depending on your chronic condition, you can reach out to or find a Medicare Advantage plan that actually covers chronic conditions. They're called chronic special needs plans, also known as a C-SNP plan. C-SNP. So hypertension, diabetes. William, what's some other ones?
Those are the main ones. Those are the two big ones. Yeah.
Hypertension, diabetes. If you need those type of specialized support and specialized services provided by your health insurance company, Medicare Advantage does have those chronic special needs plans, but they're not in every area, and some of them are great, others not so great. So we need to get together, Ms. Janice, and look at your options, especially coming up on Medicare open enrollment season. Well, look, y'all, it is Monday morning. We're about to start our week. It's early. I want you all to go out and attack the week with vibrancy, fun, and laughter, because that's what we do here at the Medicare Morning Show. But thank you so much for joining. Again, we are the Medicare Morning Show. We're here every Monday at 10 a.m. giving you news that you can use regarding health, community, Medicare, and Medicare education. Thank you so much for joining. Y'all have a great day. We'll see y'all soon. Bye.
Bye.